So this question most of the patients have apprehensions about. So does a child born out of IVF with donor egg program resemble the oocyte donor?
So usually when you recruit a donor, you try to match certain striking characteristics like color of hair, color of eyes, color of skin, height, and those parameters by which usually an individual is identified. So if you've matched the donor properly, it's impossible to say that this child is very different from her biological mother or the mother who has carried her. What also needs to be taken into consideration is that identifying physical variables are not passed from one generation to the next. They've been passed from generations together, about 8 to 12 generations, and it is through that genetic transmission that a person's identity is actually, physical identity is determined. So basically, if you match the donor with the recipient properly, the offspring should resemble the recipient very, very closely.
So if a couple has undergone IVF with donor egg program, are they legally bound to reveal this to their family members or the child who is born out of this program?
Legally or socially, they are not bound to inform anybody or let anybody know the fact that they have undergone oocyte donation, and the clinic also will not reveal it because it's the clinic's responsibility to maintain confidentiality.
So I think you have practiced for over 18 years. Have you seen a lot of increase in acceptance as well as cases of where you need IVF with donor egg programs?
So I think if you look at the population group that we see coming to the ART clinics nowadays, people marry late. So and in the initial years of marriage, because we have working women and professionals who have responsibilities and their commitments to their jobs. So they basically, first of all, marry late, and then they choose not to become pregnant for a certain period of time. So and then when they actually are ready for a pregnancy, they expect pregnancy to just happen immediately, which doesn't happen. So because of this advanced maternal age, we do get more and more cases of diminished ovarian reserve. There are a lot of cases of premature ovarian failure as well because of the environment that we're living in and the kind of toxins that we are ingesting and inhaling. So oocyte reserve, it's the same for sperms as well, it's not just oocytes. So the quantity and quality of oocytes is falling, the age of parenthood is increasing, and that mixture basically is, because of this situation, there are more and more cases of egg problems and sperm problems, because of which oocyte donation or sperm donation is becoming more and more common.
Accepting IVF as a treatment choice is very difficult for especially females who are borderline around 35. It's kind of very difficult, and IVF with donor eggs is actually devastating for many. It is one of the most difficult decisions that any couple is going to make. So I just want to know, what is it that you want to convey to such patients? I think it helps to know that they are not one-offs. It is very common these days. Would you want to give a message to them, or how do you convince a patient, or what do you tell to a patient to ease this decision for them?
I think the first thing is that yes, everybody would like to have a biological child of their own, and therefore they will always try with whatever is possible as far as technology and ART is concerned to get oocytes from themselves, and which would include various stimulation protocols, and and there are many stimulation protocols that you can undergo. But after having done all that, in spite of all the efforts that you have taken to get good oocytes and get a pregnancy out of the available ovarian reserve that you have, what I tell them is that, look, you've tried your best and it has not worked for you. So instead of going down the same road again and again and facing unsuccessful cycles again and again, it might be a good idea just to take a step back and just look at the situation again, and then think of what options do you have. You still have a good uterus, which is an absolutely normal uterus. You have your partner's sperms with which you can become pregnant. So at the end of the day, you will be carrying a baby, you will be pregnant, and you've tried becoming pregnant with your own oocytes, but you've been unsuccessful. So probably this would be the next best step. I won't say that it's the best thing for you, but it definitely is the next best thing for you, because the only other options left would be to, remain childless, which is fine. Some couples accept that and say that we're fine without a child, or opt for adoption. So if of three options, becoming pregnant yourself, carrying your own baby, delivering your own baby, versus adoption, versus not having a child at all and being satisfied with that. If you think that having a child, carrying your own child, is usually, I think this is what they get convinced with at the end, that they say that okay, this is the next best option that we have, so let's go with it. So initially it's a bit heartbreaking. Initially people are devastated. It is very painful for them to know that it's not possible. But eventually, over a few weeks of counseling and having sessions with them and explaining the importance of AMH, ovarian reserve, stimulations, not getting good quality oocytes, just reassuring them that it's normal to have this. A lot of ladies have this. A lot of ladies have to opt for oocyte donation, and at the end of treatment cycles, they're absolutely happy with the children that they get because of these treatment options. It's just going through that phase and accepting it and just moving on, probably, which helps.